So on behalf of Screen NJ and the Rutgers Cancer Institute, hello and welcome to Community Cares Project Echo. Thank you for joining today's session, and we hope that the information shared today will help you serve your community better. And now, just a few announcements before we begin the presentation. Dan, can you advance to the next slide, please? So just a reminder that the information contained in this presentation is not a substitute for medical consultation. A physician should be consulted for any problem or medical condition. Next slide, please. So as for our agenda today, we will do our Project Echo overview. We'll have Dan and Ellen introduce themselves, the presentation, the case study, and then we will have a question and answer forum. Next slide, please. So the Rutgers Cancer Institute became a Project Echo hub in 2021. Project Echo is a movement to demonopolize knowledge and amplify local capacity to provide best practice care for underserved people all over the world. The ECHO model is committed to addressing the needs of the most vulnerable populations by equipping communities with the right knowledge at the right place at the right time. And this is done by using technology to leverage scarce resources. We share best practices to reduce disparities, and we apply case-based learning to master complexity and evaluating and monitoring outcomes. So for more information on Project Echo, feel free to visit echo.umn.edu. Next slide, please. And I will hand it off to Daniel to introduce himself, and then Ellen, if you can please introduce yourself once Daniel's finished.
Hi, everyone. I'm Daniel Pearson. I'm the manager for catchment data and surveillance at the Cancer Health Equity Center of Excellence at Rutgers Cancer Institute. We, carry out the community outreach and engagement activities for Rutgers Cancer Institute as a comprehensive cancer center.
Thank you. And I am Elmagan Indo. I am the program director for outreach and education, again, at the Cancer Health Equity Center of Excellence here. We also run the Screen NJ initiatives through the community outreach and engagement. So happy to be here.
All right, so I guess I'm up. I'll go right into it. So I just gave you an introduction to who I am. Today we have a little session on cancer statistics and cancer surveillance and a little bit about what we do at the Cancer Health Equity Center of Excellence. I also have some data tools that are available for the state of New Jersey and some tools that we've created at Rutgers Cancer Institute that actually might be available to some of the other folks who are on the call that are not from New Jersey through some of their cancer centers. And I do see that we have some of our other, NCI Cancer Center friends on the call too, which is exciting, so they can see some of the resources we've created. But in advance, I apologize to those not from New Jersey because we do have a lot of New Jersey statistics on here, but I'm kind of just demonstrating the ways we look at our cancer disparities based on the public data. Okay, so we have a pre-test 3 questions, so I'll go through each one, and then I think Evelyn's going to pop up the items on the screen. So the first question, from 2017 to 2021, New Jersey had the 8th highest overall cancer incidence rate in the United States. True or false? Second question, for the same time period, 2017 to 2021, New Jersey had the highest prostate cancer incidence rate in the United States. True or false? And the final question, cancer incidence and mortality rates are publicly available through national and state agencies. True or false?
And we'll go ahead and give about another minute for everyone to get their poll answers in. Thank you.
Can you see my poll on the screen?
Yes, we see the slide.
Okay. But not my actual poll that popped up, right?
No, we never see
Okay. Okay. I was gonna say I was giving away the answers.
that. No, actually, we don't have it set as a quiz, so they won't get
Oh,
the
cool.
answers until the end. Okay, I think
All
we're
right.
good to go. Thank you, everyone.
Okay, so just before we start, just some key terms that pop up a few times for those who might not be as familiar with cancer data. So we have incidence, I already mentioned it. That just refers to the number of new cases of a disease diagnosed during a time frame. Usually we're going to look at the latest 5-year, but we have some longer trends today. For mortality, that just refers to the number of deaths from a disease in a time frame. Prevalence, we don't go over much, but it's really just the number of people living with a disease condition or risk factor at a given time. We're going to talk a lot about age-adjusted rates today. So that's considering the age distribution of a population, specifically today for cancer incidence and cancer mortality rates. We have areas in New Jersey that have, older populations, specifically in, southern parts near the shore, where folks go to, retire and enjoy the beaches of New Jersey in their later years. So we see some higher rates there, but when age-adjusted rates are considered, it does not make them just jump off the map in terms of the amount of cancer cases they have. We also have some suppressed data where the sample size is too small to either provide a reliable rate or to ensure confidentiality of a case. And then confidence intervals, we don't really talk much about, but it's really just the range of a variation in estimated rates. So when we talk about like county level incidence and mortality rates, a lot of times those are going to have higher confidence intervals for counties with lower populations because we have, less of a sample to generate rates from. And just some background on our program here. So our community outreach and engagement office, we have 3 major, cross-cutting aims that kind of guide our activities. So the first one is really what our office, the research and catchment data office focuses on, which is assessing and monitoring the cancer burden in our catchment area, which we consider to be the entire state of New Jersey. So this includes cancer, different health disparities, risk factors, screening rates, and a ton of other socio-demographic factors that we'll see a little bit of today. We also have our education arm that conducts education and promotes policy change in New Jersey. Ellen actually oversees the outreach and education initiatives for the COE office, and then we also catalyze research. So we kind of see ourselves as like the middle entity between the research that's done at the Cancer Center and the community, bringing research out to the community, but also bringing community needs, whether they're community identified or seen in, catchment area data to the investigators to make sure that our research and our clinical trials are, impacting the population as they should. We identify priority cancers and risk factors as a comprehensive cancer center, but we really use a lot of the data to guide our outreach efforts and also, as I mentioned, to guide clinical and academic research here at Rutgers Cancer Institute. So really what we're looking for is like, where do cancer and risk disparities exist in New Jersey? What are some common access barriers to screening among subpopulations? Ellen mentioned we have the Screen NJ program. So we operate an internal navigation team, but we also fund programs throughout the state to, navigate patients to screening and, do education components in their grants as well for screening. We also, try to identify what community partners we can collaborate with in specific areas. We have a really robust network of partners that we've developed over the past, 4 or 5 years across the state. So we can, identify target areas that we think need to be addressed in terms of, the backing data. And we work with our partners in those areas to kind of really target interventions. And then what are those interventions that could be implemented to improve cancer outcomes? Ultimately, that's our goal, is to really improve cancer outcomes in New Jersey. So we'll start with just some data, I guess, cancer disparities in New Jersey. So New Jersey has the 7th highest cancer incidence in the United States in 2021. We have the 47th cancer mortality rate in 2022, though. So we have an interesting case in our state where we see a ton of cancer cases and have very high incidence, but our mortality is extremely low. The county level maps here show kind of the regional disparities that we see very consistently over time. The Northwest and the southernmost counties in our state tend to see, poor cancer outcomes. That's Sussex and Warren, and then like counties like Salem, Cumberland, Cape May, Gloucester, Atlantic. They tend to be a bit more rural. They're not rural in the sense of what some of our other cancer centers would define as rural, but in terms of New Jersey, they, certainly are considered rural to folks who live in different parts of the state that are, more suburban to Philly or New York. So those are some regional disparities that exist. We see these pretty consistently. This is for all cancer sites, but for a lot of the major cancer sites, we see this as well, especially ones that are related very closely to social determinants of health and risk factors like smoking rates, obesity, median household income and things like that. We do see some relationship between those in our counties. And when we're ranking the counties, this is kind of how they break down. So this is the 5-year rate, 2017 to 2021. You can see the southern counties have the highest rates for cancer. Cape May, Gloucester, and Ocean, which are down here. Cape May, Gloucester, Ocean. The two northern coastal counties, which are Monmouth and Camden, have seen an increase in cancer incidence over the past 5 years or so. I think for 2020, they actually ranked number 1 and number 2, and then went back down for the single year of 2021. And for mortality, the disparities regionally are even more pronounced. You could see the darker shades of red, really pop out here for especially these two northern counties in Sussex and Warren, and then for the southernmost counties, again. And these northern counties typically are, more populated and, right along that corridor of like the I-95 corridor where we see a heavy population. So looking at racial and ethnic disparities for cancers, I just chose 6 of our priority cancer sites here for demonstration, starting with the most common cancer, which is female breast cancer in New Jersey. Rather prostate cancer, I'm sorry, but we see the racial and ethnic disparities, right? So all the races or ethnicities are represented by a specific color here, with the total being the blue bar on the left-hand side. So what stands out to me right away when I look at these are the Black or African American race for both female breast cancer and prostate cancer. The prostate cancer incidence for males is substantially higher than any other racial or ethnic group in New Jersey, and I think that's actually pretty consistent across the United States as well. They stand out among the other racial or ethnic groups like Hispanic or Asian Pacific Islander as well, although white non-Hispanic women in New Jersey do have the highest cancer incidence. And then when we look at some of the other cancers, we could see like who carries the burden for those. So lung has a similar kind of incidence rate breakdown as female breast, where we see white non-Hispanic New Jerseyans have the highest rate, but Black or African Americans have the second highest by a very clear margin. Colorectal cancers, Black or African American actually have the highest incidence rate in New Jersey. And then for melanomas, white non-Hispanics do carry the burden, a substantially higher, like very substantially higher rate for melanomas, but we are seeing some increasing rates for some of the other groups as well, including Hispanic or Latino New Jerseyans. And then for cervical cancer, Black or African American and Hispanic or Latino women have the highest rates in the state. So for a lot of the female gynecological cancers, we do see health disparities in New Jersey. Cervical, ovarian, uterine cancers, things like that. We do see some pronounced disparities for non-white women in New Jersey. So we've actually moved to make gynecological cancers one of our priorities. We had previously had them as HPV-related cancers, but we swapped them out for the next cycle for gynecological cancers because we did see some really, really large disparities that we wanted to be able to work with our investigators and our outreach team to try and tackle. And for the latest mortality rates, these are 5-year rates from 2018 to 2022. You see kind of the same stuff here, right? Those pink bars, which represent Black or African American New Jerseyans, substantially higher mortality rates for breast cancer. So even though we saw higher breast cancer incidence for white non-Hispanic women, the Black non-Hispanic women have much higher mortality rates. They also have, again, much higher mortality rates for prostate cancer, lung cancer as well. We see the same kind of trend where white non-Hispanic and Black non-Hispanic have the 2 highest rates for lung cancer mortality, clearly above Asian or Hispanic. Black or African American also have the highest mortality rate. They had the highest incidence rate for colorectal cancers as well. And this is a trend that has kind of, the gap, like white and Black incidence rate for colorectal cancer is kind of like volleyed back and forth for who had the highest, but Black or African Americans pretty consistently have the highest mortality rates in New Jersey for colorectal cancer. And then for cervical cancer, again, you see that pink bar, which is Black or African American, being almost 2 times as high as any other racial or ethnic group for cancer mortality. And just looking at trends, so we have 20-year trend lines here for those 6 cancers that I just showed by race and ethnicity. So you can kind of see the direction that they're all going. So, we actually have what looks like an increase in breast cancer incidence rates among all of the racial or ethnic groups since 2002, from 2002 to 2021. For prostate cancer, we've seen a pretty, consistent decline in cases, although Black or African American cases seems to have ticked back upward a little bit over the past few years. Lung cancer incidence seems down overall. Colorectal cancer trending downward as well. Melanoma kind of flatlining, and then cervical cancer incidence is decreasing among all the racial or ethnic groups. But we smooth these lines out because the points are so volatile from year to year when you're looking at racial or ethnic groups. So you're getting a general trend on these, but I did include the actual lines for each data point, which I think is useful too, because you can see, kind of the volatility year to year between these things. And what I wanted to point out, and I'm sure a lot of people on the call are familiar with, in 2020, we had, the COVID-19 outbreak, which really prevented people from going to get screened for cancer and from, doing their general checkups overall. So we saw across the board decrease in cancer incidence from 2019 to 2020, specifically for some of the more screenable cancers. So you could see here for female breast cancer, we have this really sharp decline from 2019 to 2020. Same thing for prostate cancer, for lung cancer, for melanoma, for colorectal cancers. And then what we have in 2021 is what we're calling kind of a rebound effect, right? So incidence rates, not only have they increased, but they actually are largely increasing, pretty frequently above what the 2019 rates were for some of these cancers. So you can see here for female breast cancer, the 2021 rate is higher than any of the previous 20 years, and the same for any of the other racial or ethnic groups in the female breast category. For colorectal cancers down here, on the bottom left, you can see the same kind of thing where the 2020 rates are, higher than they were for the previous 5 years, just bouncing back from those low 2020 rates. So factoring in all the 2020 data issues that we're seeing is interesting. So 2021 always kind of has to be taken with a grain of salt, as does 2020. But we're looking forward for the 2022 numbers to come out sometime this spring, so we can really see how things have recovered from those 2 years. And then again, just you can really see the pronounced disparities here in some of the cancers when you look at how much higher the prostate cancer incidence line is than any other racial group. And then you can see the colorectal trend line, much higher than any of the other groups here too. So I think this gives you a good idea of what the disparities look like. And then for mortality, again, these are trend lines over the latest 20 years of data. So it would go from 2003 to 2022. Again, the pink line representing Black or African American, you can see they're substantially higher for female breast, for prostate, for colorectal, for cervical. There's a pretty wide gap from that line to any of the next lines on those specific plots. Although the good thing is the rates are decreasing, right? So even though we do see disparities in the racial or ethnic categories, the rates overall for all of these cancers are decreasing in terms of mortality, which we do really like to see. And that's just if we were looking at all the points. I'm not going to go too deep into that one. But yeah, it's there. So when we share the slides, you can take a closer look at it and see, how it moves year to year. All right, so we have some useful cancer resources if you're interested in looking up data as well. So our state cancer registry has a really good interactive website that features a lot of cancers. So they get the cancer data. We're one of the SEER registries, so we are pretty fortunate in that regard, that we're also included in the SEER stat data set that you can find online, so we can get our information on there. but the cancer registry has a ton of different fields, so you're going to get a lot more, you know, a more robust cancer site data set than you would get on a site like the State Cancer Profiles or CDC or something like that. It goes all the way back to 2000 for years, and you can filter by race, you can filter by sex, and you can, do single year, and it shows you the rates by county. When you hover over anything, like it pops up, and you can download. There's different downloadable methods here. You can go like by age range. You could get like the top cancers in a county. So they have a really cool tool that gives you a lot of ways to interact with the data and download the data. I like to use it. I think it's best for just comparing maps side by side and looking for like very specific disease sites, like for instance, like a specific area of the colon or rectum. Like if you wanted to look at like, the descending colon specifically, they have that on there. And they have all different types of leukemias and lymphomas and things like that. So when I want some like really granular stuff, I go to the State Cancer Registry. Again, they have downloadable Excel files for annual and 5-year age groups and the county rate maps. We also have a behavioral risk factor survey in New Jersey. So I'm sure a lot of folks are familiar with the CDC's behavioral risk factor surveillance system. We have a similar survey here that's done in New Jersey that we like to use for our data. So it has a ton of different, health indicators and data points that we can find, and you can stratify them by, any of those, which is really helpful. So I like to use this for risk factors in New Jersey specifically. I think it's just easier to navigate than some of the other websites that show risk factors. It has up-to-date colorectal, breast, and cervical cancer screening, and it has some of for our use cases, like a lot of the New Jersey Cancer Control Plans goals or baselines are built around the New Jersey Behavioral Risk Factor Survey. So this is good for us to go reference that because the wording of those questions are the same and they're taken exactly from that. So when we're comparing things like that and kind of looking at our long-term goals for the state, this is a great place for us to go. The State Cancer Profiles, this is for anyone, not just New Jersey. This is kind of like I think this is one of the most popular probably places to find cancer incidence rates and mortality rates. And now they actually added screenings and risk factors to here as well. I really like this one because you can choose to look at a map, but you could also choose to look at one of these tables here, which I think is just like the easiest way to look at the cancer rate data. And what's good about it is if you're looking at your county level data, it automatically gives you your state and the United States rate right at the top, so you can easily compare and get that information. Whereas a lot of times, like if you're downloading data from SEER, you're going to have to, download the counties individually, download the state individually, download the United States individually. So it's a little bit easier to use like this. So I like to use it for these tables. I think it's really cool because it also gives you the rank, so you can quickly say, all right, Ocean County has the 5th highest cancer incidence rate of all the counties in New Jersey because it says it right there, right? So I think it's pretty cool to use for that regard. You can download all this stuff again. You can download the data. You can download the maps. It's a really great site and it's run, federally, so we know it's like up to date. Yeah, they have cancer mortality, cancer incidence. You could look at the latest 5-year cancer incidence for a county level, and you could look at the latest 5-year or single year cancer incidence and mortality if you're looking at a state. So it also can rank the states too. So we have the county rankings here, but if you're looking and want to see like where your state ranks in terms of a specific cancer site, you can do that as well. SEER Explorer is pretty cool. It's a little bit more detailed. So this is using SEER data. What I like to look at this for, they have really cool trend maps. A lot of it is national cancer rates. So if you're looking at just like general information, like if you're writing a grant or if you're writing like a clinical trial, this is a pretty good place to start. It also includes some really cool things like the breast hormone receptors, so like HER2, ER, PR, some different lung cancer receptors, things like that. So it gives you like these different ways to look at some of the most common cancers that we see, not just in New Jersey, but the United States. And I think for that, I think it's a really useful resource. Yeah, so you can look at trends by like HER2 positive breast cancers by race and ethnicity in the United States. Like that's a pretty cool feature to have, and I think it's worth mentioning here. So a lot of times we get, we go around and we get asked for this like sub-county cancer incidence data, which really doesn't exist in most cases. So one place that I do direct people to, although right now the data is a little bit outdated, is the CDC's Environmental Public Health Tracking Network. So it has kind of like the first publicly available sub-county cancer incidence rates for, I think it was breast cancer, prostate, colorectal, and lung in New Jersey. So they have developed these like 5 and 20,000 person population areas in New Jersey and modeled cancer incidence rates to those areas. So you can see them here. It's not census tract level; it's a little larger than that, and um, but it's sub-county level cancer incidence, right? So we get these requests all the time, and when this came up a couple of years ago, we were really excited to see it, and we're hoping that I think they actually implemented a newer round of data, but it's not publicly available. So that was disappointing. But if anyone has access to that and it's not, and I'm incorrect in that statement, please, feel free to jump in and correct me. But it's cool. You can download the data as well. You could download the maps. You could zoom in on them. So you can kind of see like little pockets of higher cancer incidence in your state where they might exist. And it's great for densely populated states like New Jersey because we do have, in a 5 or 10 minute drive, you can really see, a difference in, neighborhood. And it's just like we have a very unique state in the way that it's laid out. So I think for us to be able to look at, pockets of cancer incidence is very useful. And New Jersey is working on a tool to bring what's called cancer zones to New Jersey. I should go back. So I think Louisiana has it, and a couple other states might already have it, where they've modeled cancer incidence rates to lower levels than county. Or they call them parishes in Louisiana, but New Jersey would be county, and this would be essentially doing like what the CDC has done here, but we're going to get, um, you know, probably anywhere from like 5 to 10 areas per populated county, and some of the lesser populated counties will be, whole area data. But we're excited to see that and waiting for it to release eagerly so that we can see some sub-county level data that's, very up to date and from New Jersey. So our team has a dashboard that we created as well. It's called the Stride dashboard. It kind of just aggregates all of this stuff into one place. So that was kind of the idea behind the dashboard, was that we didn't want to have to go to 4 or 5 different websites to get all the information that we desired. So we had started by creating this and, putting some maps and some plots together that was pulling in data from a few of these sources. And then we were able to, I'm sure a few people are familiar with the Cancer in Focus application as well. So that was developed by the University of Kentucky, and it's just the best. It's like a socio-demographic like monster, and it just pulls in over 150 variables across 10 categories. What it does that I love, and like I'll show a little demo of it, it has data that's available not just at the county level, but also at the census tract level. So it's using like CDC Places, the American Community Survey, and the US Census to kind of aggregate all that data into one place and make it a very useful tool and really easy to use for people. So I'm going to show it today because I think while it's relevant to New Jersey, there are other cancer centers across the country that are also using this. So if you are someone who is in the area, like I saw, there are people from Wisconsin, North Carolina. I saw Oklahoma Cancer Center. Like I know a lot of these places are using this tool already, so it's possible that you might already have access to it for your state or for your catchment area. So there's 3 different applications. There's the main one, which creates pretty much just maps with location points available to plot. There's a profile application, which gives you the ability to like look at your county versus other counties and also download a comprehensive report versus the state rates. And the bivariate mapping tool, which gives you the ability to compare 2 variables against one another, which I think is really cool as well. So here's just a list of like some of the variables that are included on there and their categories. So you can see we have like cancer rates, sociodemographics, economics, environment, cancer screening, transportation, risk factors, disparities, health factors like chronic disease, and access to healthcare, and then also location points that we get from federally approved sites. So the GI providers come from the NPPES, the lung cancer screening sites from the American College of Radiology. The mammography sites are from the FDA, and then we also have FQHC and HPSA locations that are plottable right over the map, which is really a cool feature too. So instead of showing these slides, I'll just go through a little demo. I think we should be able to do this pretty easily here. Yeah. Okay, so we have our Stride dashboard. I'll briefly go through this one. It's pretty simple. So some of the visuals that I pulled into my presentation are actually from here. So we have like an interactive county map, right? So this is just showing the rankings of the counties next to the map itself. You can look at all the cancer sites that we have here on this list, but it's very easy to use. These are all downloadable images as well. You can, swap from incidence to mortality rates pretty quickly. You can switch your sex, switch your race and ethnicity. And yeah, it just gives you like a good sense of, regional disparities in New Jersey and what they kind of look like. So, if we switch to colorectal cancers, you could see, I mentioned these disparities in the Northwest and in the South of New Jersey, and that's very apparent when you look at colorectal cancers as well. We also have trend lines. So these are a version of what I showed in my presentation, but they're really just showing, incidence and mortality rates over time. We have a full data set from 2000 to 2021 in here. This is all from SEERStat, but you can filter your year range. So if you wanted to, only go for the last 5 years, you can just use the little age range slider and it will just show the last 5 years of whatever you select. So basically this works the same way. The left-hand side has your filters. It has all of these data sites on here. So you can see this is a ton of stuff. It's from SEERStat again. So you're going to be able to look at, all of those kind of unique cancer sites along with the major ones, which I think is really cool. Different types of, leukemias and things like that. It's a really useful tool. And yeah, if you change, any of the filters, it's going to update automatically on the right-hand side. We have the New Jersey and the United States on here, but you can add any state you want. If you hover over the points, it gives you more information about, what we're looking at. We also have some staging information from SEER on here, and anyone can get this that has SEERStat access, or we could, run it for you. But basically, it's calculating the amount of the percentage of cancer cases that are diagnosed at each summary stage. So that would be like localized cancer, regional cancer, distant cancer, which is stage 4 cancers. So yeah, if you wanted to look at disparities this way, you could do it. So if we look at colorectal cancer and then focus our attention on this second column here, which is Black or African American, the orange represents distant cancers. So you can see that, from 2012 to 2021, 27% of the Black or African American colorectal cancer cases were diagnosed at a distant stage, whereas for all the other groups, it's under 22%. So you can see there's a clear disparity there. And that's just one way to use this tool. We also have the trends for staging as well. So if you wanted to look at the trend lines for any of the staging on cancers, you could do that. You can, if you just wanted to look at one, you could do that and see, So there's a lot of little different ways to play with the data on these. But I think what I really wanted to show everyone was the Cancer in Focus application. You can access those directly from our main app right here on the last tab. But I have them up here just so we can do a little like show you what exactly you can do with these applications. And again, this one's for New Jersey, but these do exist all over the country, hosted by different cancer centers. So if you are in an area where, you're near a comprehensive cancer center or you are a comprehensive cancer center, it's possible that you have this tool already at your disposal. So this one, like I said, it's got the ability to plot census tract information. So it works very simply. I like to start on the left-hand side and just go through my filters first. So what we'll do is we'll select a geographic level. So I'll pick census tract, and that'll update our map on the right-hand side here of New Jersey. Then what we do is select our category of variables. So I showed these before. Right now it's on socio-demographics, which would give you the ability to plot things like, the age group, the percentage of, race or ethnicity, education, and things like that. But if you were to change the category, it will update your variables. So I selected screening and risk factors. It defaults to breast screening, so you could see that it updated there. But we can select colorectal cancer screening. You can select, currently smoking, and you can see that it just automatically updates on the plot and shows you the rates for each census tract based off the data variable that you select. So we can also add geographies to this. It's a little difficult in New Jersey. We have, really weird geographies for our counties. So if you're looking at census tracts, it's kind of hard to identify where one county ends and one county begins. So we added county borders on here too that you can kind of just outline over the census tracts. We also have food deserts that you can highlight on the map too to show areas that are considered a food desert. And we also, like I mentioned, have different screening facilities and oncology sites across the state. So the ACR's lung cancer screening registry has all of these sites listed for New Jersey. We can look at FQHCs. And then if you hover over any of the dots, it'll give you information about that site. So this is the Burlington City Health Center. It's considered in the FQHC, other HPSA category. It shows you the address, the phone number, which is really great because if you're looking to get access to a place like this for screening, I think it's super helpful. And also what we've, kind of seen as a good use for it is finding areas with low cancer screening and then looking for, providers in that area that you can work with to do some outreach initiatives. So that's been a cool tool for us to use for that regard. But yeah, this is a really great tool. You can zoom in, really far. Basically, like if you're trying to find like a restaurant on a map and you're like can't figure out where to go and you zoom in all the way, this is kind of how you would do it. And you can see through, as we're zoomed in on Camden right now, so you're zoomed in and you can see through the actual colored layers of the map, which is neat. Now, what I like about this too is we have some customizable options for the maps. Like not everybody wants to look at a blue and green map, right? Our organizations all have different colors. We might want to, throw these in a PowerPoint presentation or a grant submission or something like that. So we can quickly download these as well. You can download the map or download the data right in the right-hand side here. So it's going to download whatever you have on the screen. So if I hit download map right now, this exact image is what's going to spit out. If I was zoomed out all the way to the whole New Jersey level, it would spit out that. And when you download the data, it's downloading whatever data variable you have selected by either county or by census tract. So it's really easy to use. It's really easy to download these things. I love using this for like my presentations that I do, especially for specific areas of New Jersey. So I can just like quickly zoom in, find what I'm looking for, download it, and just like add it right into a slide. It's super helpful. But like I said, we have customizable options too. This is just kind of like nerding out on the dashboard features itself, but we have over 20 color palettes that you can change to. So the top selections are colorblind friendly. This whole range of, they're called the Viridis palette and R, but they change whenever you click on it. If you wanted to look at this like nice red and purple one, which I actually really like, you can look at it that way. What you can also do is change the scale. So it's set to a continuous scale, which means that it's like factoring in every single data point to make colors. So it's going to be more smoothed out as a gradient. So if we zoom out, you can see how it's kind of like a little bit smoother in terms of the color and how it blends into one another. But if we click on discrete, it's going to bucket these colors into 5 different groups. And you can see that it's like more pronounced, like areas with low smoking are more pronounced. Areas with high smoking rates are much more pronounced in those darker shades of red and purple. So there's different ways to look at it. And if you didn't want to like look through the map, you can change the like if you can see through the layers here, right? So we call that opacity. So we have a little slider here where you can set it to 1, which means that you would not be able to see through it at all, or you can, set it to lower numbers, which would give you the ability to really see through it at a higher level. You can also add custom data into here. So if you had like location points or a map layer for county level data or census tract level data, you can actually upload those right into here and it will populate the map for you. So that's a cool feature. I don't want to get into that because it's a little bit of a demonstration, but it's a very cool feature. Yeah, so that's all I've got on the main one. The profiles application is quite simple. It's really just looking at county level data. What you can do is select your county. So if you wanted to look at Essex County, that's where Newark is in New Jersey, for those not from New Jersey, our major airport up there. We have two ways to look at things. You can just look at a standard table, or you can look at a bar graph. What's cool about this is not just the ability to say, all right, well, Essex County has the third highest population in New Jersey. We can see where it ranks among all 21 counties. But this one has the ability to create a full data profile for a county, which is really useful because a lot of people are looking for things like this and we get asked for them all the time. So when this was created, we were, super excited about it. So you can create a data profile. If you click on this, it will download something to your computer for that specific county. So I have an example of one here for Warren County. So it takes all of the variables that we have available for county level data, and it spits out this little PDF report for you. It gives you the value for the county, and then it gives you the median for the state. So, you can see you have the sociodemographics, they're all lumped together. The economics are all lumped together, the environment all lumped together. It's just a really nice way to look at everything that we have on there in one spot, especially for, folks who are working with county specific organizations or doing county specific kind of presentations. These are good things to have on hand. If, anyone asked you what is the, percentage of people with coronary heart disease in Warren County, you could tell them if you had this report on hand because it is included in the data. And those are available for all 21 counties. And the last app before I hand it to Ellen, I think we have a post test too. This is the Bivariate application that I mentioned. So this has the ability to plot two variables against one another, which I think is very cool. So basically you would select your X and your Y variables, right? So we'll start with the top, which is the X variable. We can look at screening rates. We'll do colorectal cancer screening recommendations, and then we'll change the second variable to insurance rates. So essentially what we see here, right? This is using a 2-color scale to create these color palettes, based on the insurance rates and the colorectal cancer screening rates. So places that are more blue on the map would have, higher colorectal cancer screening, but lower insurance. And places that are more red would have high insurance rates, but low colorectal cancer screening rates. So like somewhere like Salem County down here. The darkest purple ones are places that have both high colorectal and high insurance, and then the places that are like purple down here. So like for instance, Cumberland County in New Jersey has that exact color shade on it. They have a low colorectal cancer screening and low insurance rates. So what I like about this is like not even just looking at the map, but I think it's really useful to look in a scatter plot format too. So this is giving you like the actual X and Y, right? So you picked your X, that would be colorectal screening. You picked your Y, that's insurance, and then it plots all the points. We have 21 counties in New Jersey, so we only get 21 data points when we look at it by county, but you can see there's a clear relationship. It tends to be, counties with higher insurance rates are counties who are more likely to have higher colorectal cancer screening. Now, this is really cool because we can look at census tract data as well. So instead of having 20 points, we could have 2,000 points on here, which is really great for someone. If you're like a nerd like me, you like to look at stuff like this. But you can again see like some type of positive relationship. If you are in the census tract view and you hover over it, it's going to give you the county that census tract is in. But it's not going to give you like municipality or zip code or anything. That would take, a different amount of joining data sets to get that information in there. But this does show up on the map too. So like I said, New Jersey is really, unique in that we have, in a 5-minute drive, you can go from one of the wealthiest neighborhoods to one of the least wealthiest neighborhoods in the state, and multiple places. So I think looking at the bivariate map and looking at census tract data is a little more useful than looking at county level data for things like this. So for instance, this is Union County right here. We have like Elizabeth is in Union County, Plainfield, um, but also some very wealthy cities, and the same thing for Essex County up here. So when we see this, it looks like, okay, they have really high colorectal cancer screening in these counties. But if you look at census tract level, you can see that there's areas that actually fit the bill for having low cancer screening rates, specifically in areas of Newark and areas of Elizabeth. So just looking at the county picture is not always the best, which is why we love using this census tract data tool to identify spots of areas of need, and trying to get this word out to our community partners, get this word out to the investigators at the cancer center, and also having our outreach team and our navigation and our mobile health unit team be informed by the data to carry out their operations in the community. I know that was a lot. I'm sorry, but if you have any questions on that, you can reach out to me, or drop them in the chat, and I'm happy to answer them. And we have the links to these tools in our slide deck as well. But I will get back to the presentation with that. Yeah, that's the QR code for the main dashboard and all of the links. We have URLs for each one just to make them easier to access. Like if you're specifically looking for one, this will go out, and then I think we have to do the post test as well. So yeah, here's the post test. I will say the questions. I think I might have went over time a little bit. Do we have any questions in the chat? In the meantime,
We do. I wasn't sure. I usually have questions after the case.
oh, cool. Yeah, no worries.
Yeah.
Okay, so these are the questions again from 2017 to 2021. New Jersey had the 8th highest overall cancer incidence rate in the United States. From 2017 to 2021, New Jersey had the highest prostate cancer incidence rate in the United States. I don't think I mentioned that during the presentation, but it is true. I will say that. Sorry, I'll give you the answer. And cancer incidence and mortality rates are publicly available through national and state agencies. True or false?
So just waiting for a few more people to finish up the post test before we go through the other two answers. I like to get at least 75% participation. So we're getting there. So if everyone can please do the poll, that would be wonderful. Dan, if you want to answer the question while we're waiting for the poll results, it's what database will you suggest for identifying mapping distribution of community organizations and resources by county?
That's a
a great
good question.
question.
Yeah. I mean, yeah, I tend to focus on the cancer related items. So I don't know if anyone, maybe Ellen or Evelyn, you would know better if there's something available for something like that. I think the New Jersey Department of Health, if the question is from New Jersey, just released, didn't they just release like a mapping tool like this? I feel like I saw this in the last like month or so.
If they did, I don't recall seeing it.
All right, I will look that up while Ellen goes, and then I'll answer in the chat because I think it does exist.
All right, so it seems that we've leveled off on answers. So if you want to go ahead and review, Dan.
Okay. Yeah, it was 7th. It was not 8th. You're right. Elizabeth Elizabeth said that in the chat. I don't know if we made a typo on that or we confused people with the question, but yeah, New Jersey does have the highest prostate cancer incidence, and yes, you can get cancer and mortality and incidence rates through state and national agencies. Rachel, congrats on getting Cancer in Focus. That's exciting. It's a super helpful tool if you ever need like help with any of the stuff. The Kentucky team is so helpful. So I'm excited for you guys to get that.
Thank you. Okay. Yes, thank you. I just want to say thank you everyone for coming in. I know this is the middle of the holidays for a lot of us. So I want to get through this as quickly as we can. But Daniel showed a lot about the tools that they use to kind of create and monitor the cancer burden across the state. And I want to kind of give you a little bit of a snippet about what it looks like when we actually take that data and we put it into practice. So we can go on to the next slide. All right, first, before I even get started, I want to kind of take a moment and pause and recognize that when we build a campaign, there's a lot that goes into the process. Any initiatives we do, and I think a lot of us are familiar with that process. We look at the data. What is it telling us? But the data is not always numbers. It's looking at literature and everything else. But that's kind of where we're sitting before we can even get to the point of designing the program, implementing it, even measuring its success, and then being able to sustain or scale the program out into other communities. So we're in the very beginning process. This is generally where we take the tools such as Cancer in Focus and we start looking at it and we really identify opportunities. So I really kind of want to hone in on that step of the process for now. So we can go to the next slide, please. All right, thank you. So here we're going to talk about a little bit about the gathering of the evidence. That's where we're kind of hyper-focused right now. For us, when we get prepared to do a program, whether it's a new workshop, whether we're looking to do any kind of localized campaign in the community or a statewide campaign, we need to look at the data. What is the data telling us? So we're looking at statistical surveillance data, such as Cancer in Focus or the STRIDE dashboard or other publicly available data sources. That's what we're going to focus on here. But other pieces of resources that we're using are not limited to just that. We're also looking at what does the community inform us? This could be through a needs assessment, through a survey, talking to community organizations or people that live in that community and find out what the need and the attitudes are around that area. So also looking at the policies. What are the policies telling us? Are the policies changing? Have they changed recently? And are there more localized policies that could inform anything that we're going to do? We also look at the literature as well as those personal experiences from our team, but also from the community as well. So, but today you can click one more time. We're just going to focus really in that statistical surveillance data because that's all the time we have today to really focus on. So we're going to kind of hyper focus in there. So this is just a sample of us looking at trying to find some kind of grassroots opportunity and saying, let's pilot doing a hotspot campaign. So what we wanted to do is we wanted to find some low-hanging fruit. We're not looking for the areas with the greatest burden for now, but we're looking for the greatest opportunity. So we pulled this together. We used the STRIDE dashboard and we looked at looking at breast cancer because we find a lot of people are very receptive to breast cancer campaigns. So with the goal of by 2030 being 80.5% of women 50 to 74 years old receiving those cancer screenings. Next slide, please. So we looked at the state overall. We said low-hanging fruit, Middlesex County. So we zoomed in here, and some of these images look kind of familiar from what you saw with Daniel showing us. And we said, what are the screening rates? And we're like, okay, well, the screening rates in Middlesex, there are a couple pockets areas, and we saw a few low spots. Like, let's start looking at some other areas. So we started looking at some of the demographic data. And one thing that popped out, we looked at the Black non-Hispanic community. Nothing greatly popped out in Middlesex County for us to say this is a great opportunity for a very localized campaign. So then we looked at some of the other socio-demographic data, and the Hispanic community popped up, and you can see in the corner there's kind of like an area where we see a nice dark spot, and we said, ooh, that looks like an opportunity to really address, and there may be some low-hanging fruit here. So next slide, please. So we realized as we started getting closer and focusing more that this is Perth Amboy. You can click again. There's some animations on this slide. So This is where we're going to focus. This is generally the Perth Amboy area of New Jersey. It is a large Hispanic community, not a very high Black non-Hispanic community, but this is a very high Hispanic community. So we started using the data, you can click again, to look further into the community and to tell us what we're seeing here. You can click one more time. So we're looking at the incidences of the Black Hispanic community right here. We can click one more time. Okay. And now we're looking at some of the data that we were finding in terms of the Hispanic community living below the poverty line. And we do see a couple little spots here that are telling us that there are some opportunities, knowing that there is an FQHC in that community. Click again. And then we said, well, let's continue looking. Let's look at the insurance rates. And we use that to kind of help guide the process here. And you can see here in that same little bucket we're looking at, we see some pockets of higher burdens of low insurance rates among the Hispanic community. Click again. And this was really telling for us. And when we looked at the obesity rates, and we're saying this is a high obesity community with people with obesity. So this is something that we're saying, okay, this is a part of the prevention component, that perhaps there's a need for prevention here, as well as trying to promote screening. Click again. Also looking at some of the overall health reports. So how are people reporting their health? And you can see again, there is that pocket right in Perth Amboy. So this for us said there's a real opportunity for us to try to design some kind of a campaign. Click again. All right. So this tells us we've got a real opportunity to do something that is culturally relevant, because this is what the data is telling us. The data is telling us that there's a very heavy Hispanic community in this area. So we want to make sure that we are being responsive to that cultural need. Also making sure that whatever programs we do provide, it is bilingual and it's accessible. Also, we recognize that there needs to be some kind of a community-driven construct from that, because we see a lot of low income in that community, individuals that are underinsured or uninsured, and also looking at really pulling out of the partners in the community and saying, we really are going to need their engagement and their buy-in for this type of a local campaign. So we started kind of looking at some of the other data around. And so I'm not going to go into how we found that data, because we used a combination of different data sources. But some of the things that we recognize that this community, there's a lot of salons, a lot of bodegas, it's very walkable areas. And we said there's a real opportunity for us to work with the local businesses and business owners that have more of that social component to it. So that's something that we're saying, okay, these are some pieces that we need to include based on the evidence that we're finding. And then we said, how are we going to design this campaign? What does this campaign look like? Is a digital campaign the most effective in this community? Are they posters, flyers, salon talks? What is it that's most impactful for this community? And this is where some of that data has started telling us these are some of the ideas that we need to consider, based on what we're seeing from the literature, from the community-based organization in the area, from our own practical experiences being out in those communities. Next slide, please. So again, I think I jumped a slide here. I'm trying to keep it quick, so I know there's a lot going on. People have a lot to do, but we can keep going here. And those were some of the major things that we really wanted to tell us. So what did this data tell us? This data told us that we have a huge opportunity to do a grassroots targeted campaign. And this is where we're saying this is a pilot. This is something that the idea is that we can replicate this throughout the state in different areas, and really utilizing some of these resources through the Cancer in Focus. I'm really excited with some of the tools that the Cancer in Focus recently has implemented, and Daniel shared some of those today, where we can go a little bit deeper. We can dig a little deeper on some of the different components and looking at where are the mammogram locations. We know that there's 3 mammogram locations in the Perth Amboy area. So that's an opportunity. Do we want to utilize those resources? So those are all things that we've kind of pulled from the data that we've been able to see here. And I just wanted to really share how we pull the data to kind of inform the development of programming. So next slide, I think this is, yep. So at the end of the day, what does this mean? It means that this data has informed our logic model. Does it mean that we are done with the program? No, not by a long shot. This is only the beginning of the process. But I think making sure that we are continuously looking at how that data continues to evolve and change and inform as we continue to move forward. So I really wanted to kind of go back, zoom back out a little bit and say, even though it's a lot of work, that really informs just a small subset of the work that we're doing. And I think a lot of us are very similar doing outreach activities in our own communities, in our own catchment areas. But at the same time, it doesn't have to be just for an intervention. This, as Daniel mentioned, this data used in a similar way can be used for grant applications. We use this when we're reviewing our grants to help us determine, are there needs in this community, and are these applicants hitting areas of need? So definitely something we really reside on. So thank you. And I think next slide. And I think that's it, because I think it's a repeat of the questions. So that is all.
So does
Kept it
anyone
nice and
have
quick.
any questions or comments? I see one. Our Cancer Center recently launched Cancer in Focus for our catchment area. These presentations have been so helpful in looking at, ways to utilize this data, especially at the grassroots level. Are you able to share the slides? Yes, we'll be sharing everything on our Mighty Networks, which is where we share recordings and resources and the slides. Does anyone else have any questions? I thought I saw something else. Nope, that's about getting the slides. And then what is the cost associated? Dan did answer in the chat. So Cancer in Focus is free to use. You just have to reach out to the University of Kentucky folks that I can attest are also wonderful to work with, and they can help you set that up. And then Amy shared a resource of cancerinfocus.org, and then that may be the resource provided as well.
Yeah, the cancerinfocus.org site is kind of like Kentucky's main hub for it. So it has like their application, but it also includes some of the other apps that they've built on there as well. And the data sources, I think, are pretty helpful too. So you can see where all this stuff comes from. This is the website that was just shared in the chat.
Fantastic. Next slide. We have a couple of more housekeeping things. So as always, we love to share the information on our New Jersey seed, or NJ seed. They are available to provide screening for those that are un and underinsured, and they specialize with breast, cervical, colorectal, and prostate. And I will drop that information into the chat. Next slide, please. Thank you for attending today's session. The eval I posted, I will drop again. Bear with me for just 1 second as I'm pulling up my links. I'll throw that in the chat. And then next slide, please. Last chance for Mighty Networks. So we'll be closing off the registration for this particular Echo series. So if you want access to everything you've registered, just make sure to register for Mighty Networks, and I will throw that in as well. If anybody has a problem accessing Mighty Networks, let me know. And we'll do our best to help troubleshoot that. Okay, and one more slide. This is the one I was waiting for. This is I'm really excited about. We're actually having 3 community cares programs so far in 2025, and community cares is our professional education branding, so you're going to see that a lot. We have one that we are working on with Charcheret, which is on cultural competency. We're planning on 3 sessions. The registration is TBD. As soon as we have that squared away, we will be reaching out to everyone on our mailing list. We are launching a survivorship series on January 28th. That's going to run monthly through 2026. I believe we're going to be doing about 2 years worth of that one. And then we are doing our Back to Basics. So for those of you that have been with us for a while, in 2023, we ran a project at Community Cares basic priority cancers guidelines series. So we'll be running that again. So we'll be doing our cancer basics, our colorectal, prostate education, breast, so all of that. So if you've missed that series or you have new team members who've just joined and you want them to kind of get caught up on that cancer guidelines, those basic cancers that are routine screenings, definitely share this with them. Those two QR codes are to register, so you can register right now if you want to. But that second Back to Basics is going to be a repeat of what we did 2023 with updated data, of course. But for anyone who missed it, or again, if you have colleagues new to your team that you want them to get caught up to speed, I highly recommend sharing that with them. Okay. Let's see. Any other messages have come in? We do have a question. What database will you suggest for identifying, mapping the distribution of community or, oh, we did that one. Sorry. It looks like my chat scrolled up. But if
Yeah, no
anybody
worries. I'm looking for that. I know it exists on the New Jersey like Department of Health page somewhere. They promoted it like in the last couple months, but I do not see it anywhere. But I'm gonna find it.
All right. So if anybody else has any other questions or comments, this is our last session for 2024. Thank you for sticking with us. It's been wonderful to have you all join us on this journey throughout the year. I'm hoping to see you again in 2025 at our upcoming programs. If you have any questions, comments, observations, this is the time where you are welcome to unmute if you like and ask a question directly to the team or any kind of comments or observations, please feel free to share. As for the recording for today's session, give us about 2 weeks or so to get it onto Mighty Networks, but we will definitely have access to the PDF, so you have the clickable content and the recording of this session. Thank you, everyone. Thank you for that wonderful feedback. Make sure you let us know in the evaluation as well. Click that link. And if anyone is interested in providing cases, as you know, ECHO, first half is that education, the second half is that case. If any of you would like to provide a case study for any of these sessions, please reach out to me. We would be happy to consider that. And if you want to save the chat for your friends who were listing where they were from, if you go to where it says Community Cares Project ECHO in the meeting chat, you see 3 dots. You hit on those 3 dots, click there, and then you'll see Save Chat. You're welcome to save the chat for today as well. So again, thank you, everyone. I don't see anybody asking any other questions, so I think we are good to call today's session completed. Don't forget to register. We'll be sending out email communications. If you're not sure you can register today, don't worry. We're going to be sending out email communications on these upcoming sessions. Just wanted to get that out there for the early birds. But thank you, everyone, for joining us today. It was a pleasure working with all of you this year.